We will leave time at the end for questions, but if you guys have any burning questions as we go along, just raise your hand, throw a sack at me, yell, because I'm more than happy to answer as we go. There's quite a few slides in here. There's quite a bit of information in here. There's nothing that says we have to get through everything. So we'll get through it, and if you can save the questions, great, but if you can't, just stop me. And I may ad-lib a lot as well. Okay, so one of the things people often want to know, and I think that we as providers forget to tell folks when we first visit with you all when your babies are born, is when are the well child visits for your babies? When do they come in? What do we expect of you, and what should you expect of us? So this is typical. This is what insurance pays for, and almost every insurance company, I can't think of one right now that doesn't pay for your baby to have well child visits. There is a recommendation out there to have a visit at 30 months or 2.5 years as well. That one insurance company, some don't like to pay for. So rule of thumb is after they hit 2, a visit every year. And that isn't just when they hit kindergarten you stop either. Most insurance companies, and again I can't think of one that doesn't, will pay for your child to have a well child visit every year until they're off of your insurance. I would recommend that as your kids get older and they get busier. Sometimes I think it gets lost and forgotten, but for a couple of reasons it's nice. First of all, it lets us as a physician and a pediatrician establish relationships with your children. Babies are hard, little kids are hard, toddlers are hard, adolescents are hard. And if we can have a good repertoire and relationship with them from the very beginning, it is actually beneficial to you all. So yearly thereafter goes until they are out of your house. It doesn't include bounce back. So 25, that's your guys' deal. Why we do well child visits. We want to monitor their growth. We want to give them immunizations. I think those are two things people automatically assume that we're going to do, and we do. But we also want to discuss your questions and any common concerns. That doesn't mean we won't deal with uncommon concerns, but this is the reason for it. So that you guys aren't sitting there with your 2-month-old baby and wondering if this is normal. People go into pediatrics because we actually like children, we like parents, and we want to answer your questions. So we don't want you guys at home struggling with the do we call or don't we call. That's why we do it. This is the 2013 immunization schedule. Jot this down quickly. There will be a quiz later on this one. So for what it's worth, I can hardly get this one right on a yearly basis because it has changed so much over the last couple of years. But this is what it looks like right now. There are some that have stayed true for many, many years. So why do we immunize? Why do we pick on babies? Because we're mean and it's fun. That's what I think. It's because we know that if we take and expose your baby's going to be exposed to tons of germs and infections and viral illnesses. And they will make antibodies to those, and that's how they protect themselves in the future. So what an immunization is it's essentially our way of exposing them to certain infections so that they can mount a response to it. So that when they are exposed to that infection in the real world, they get either a minimal infection or preferably no infection from it. So that's why we immunize. Why do we immunize babies? Because their immune system is fantastic, and it will respond to those immunizations and make what we hope will be lifelong immunity to a lot of these infections. Because babies are better than adults. That's also an opinion. What did I miss on that? Anyway, so we'll go to milestones now. Thoughts on immunizations at this point in time? Okay. I know sometimes that rattles people's cages. Okay, developmental milestones. So every time you bring your baby in, we also assess their development. So we're looking to see what they do. It's fun to have them do the stuff in the clinic too. It's a good time. But at 2 months, this is what's typical. They'll lift their head up, they'll follow beyond midline, and they'll coo and smile. And your doctor's gonna ask you, are they smiling at you yet? And then we get in their face and we try and make them smile because that's probably the best part of our day. And when they hit 4 months old is when they typically roll over. Some babies, now these are just guidelines. Some babies roll over before 4 months. Some babies roll over after 4 months. This is just what is typical. And everybody knows your guys' kids are not typical, right? They're like, kind of like mine. Brilliant. 6 months, the big one is sitting with support. And they'll start to try and feed themselves. A good time to introduce a sippy cup because they're really, really curious and things are going in the mouth anyway. And 9 months is when you get your cruisers, your babies that are starting to pull themselves up and might start getting around your furniture. Now, the cool thing about babies is if you don't baby-proof as you're going through these stages, they're going to point out to you what you've missed. And as you've seen, they go from the floor to a little above the floor to standing at the furniture. They get all those levels for you and everything in between. So they're kind of fun to try and anticipate what they're going to do next. The 9-month-old will also have a few words, mama and dada typically, maybe baba. And they'll wave bye. That's always a fun trick. 12 months old is typical for standing. Between 12 and 15 months old, typical for walking. So don't stress if your baby's not walking at 1 year. It's a guideline. It's not a rule. You can read the rest of these. You start working on drinking from a cup at 6 months because you want to be done with the bottle at 1 year to 15 months. You want that baby transitioned completely off the bottle at 1 year because between 1 year and 15 months, well, they're always very, very smart, but between 1 year and 15 months, they're going to start using that bottle as more of a transition object than something to get nutrition from. So if you can get rid of that bottle before 1 year, you're going to save yourself a lot of headache. Here's 18 months and 24 months. They're getting more words. They start putting words together into sentences. Now, mind you, language development isn't necessarily what you all understand as words. It's what their words are to them. If they are saying the same syllable over and over and over again for their brother's name, and it doesn't sound anything like Ethan, but it's used all the time for Ethan, and they're saying Ethan go in their own little words, that's their language, that's a sentence. Let's see. A lot of parents come in and they want to know, what can they see? Actually, what they really want to know is, when is their eye color going to be the color it's going to stay? It's usually around 6 months where we can say kind of, sort of, for sure. But this is how babies see. Babies love faces. New babies love faces. And it's what they can see. And that's kind of how they develop. By 6 months, babies' eyes should no longer cross, although crossing eyes are kind of funny. So growth and nutrition, kind of some rules of thumb. Again, don't write down in your little book, Dr. Scott said that their adult height is going to be whatever they were at 2 times 2. It's a rule of thumb. It's a guesstimate. But it works reasonably well in most cases. Additionally, as far as growth and nutrition, we want, in Dr. Scott's perfect world, every baby receives some breast milk for some amount of time. That's kind of my party line. Now, I recognize that all babies are going to get, not all babies will get breast milk, and that's okay. Babies formula feed, and they do quite well. My 19-year-old is a lovely child that was never breastfed. But the nutrition benefits of, this is my aside, the nutrition benefits of breast milk cannot even be undervalued. So any amount for any amount of time. But they need to get either the formula or the breast milk exclusively for the first 4 to 6 months of their life. As far as introducing food, and I'm getting ahead of the game, it's 4 to 6 months because as far as introducing food, kind of the recommendation right now is 6 months to introduce foods at 6 months. However, if babies are drinking an awful lot of milk, 30 ounces or more, and developmentally, they are watching you guys eat and get that food from your plate to your mouth, and they are really, really developmentally ready, it's an okay time for you to start food. And that's a conversation that you should have with your pediatrician about your child's development. Anyway, back to the milk. In our breastfed population, another thing to talk to your pediatrician about is vitamin D supplement. The vitamin D that is in breast milk is a great form of vitamin D. However, formula is vitamin D fortified. There is more in it. So some pediatricians, most pediatricians, because it is the recommendation, start babies on vitamin D drops at the same time. And that's true for babies that get primarily breast milk. Now, as you start introducing foods, that is probably not necessary because they'll get it in other sources. Kind of got through some of this stuff. Why do we introduce one food at a time? The big scary reason is for food allergies, which of course, I think if your baby has mouth and lip swelling, shortness of breath, severe diarrhea, or hives, you are going to notice and stop that food. A very practical reason to introduce foods one at a time is because you don't want to give your baby 2 foods at the same time that are going to cause diarrhea, or 2 foods at the same time that cause baby constipation. You're going to be an unhappy parent and have an unhappy baby. So introduce them slowly. The majority of an infant's nutrition, until they're probably 9 months old, and some babies even up until a year, is going to come from breast milk or formula. Baby foods, if you look at a jar of baby food, there is not a lot of nutrition in baby food. There's not a lot of calories, there's not a lot of fat. And I will dispel the myth of cereal right now. If you look at a carton of baby cereal, there are very few calories in that. There is no fat in that. It is fat that satiates us. It's fat that keeps babies, any of us, from feeling hungry. So giving your baby cereal before bed is probably not going to make them sleep longer through the night. It is just happenstance that works out that way. Babies, we start introducing around 4 months, and babies start sleeping through the night around 4 months. So is there a role for baby cereal? Some of us, including me, would say maybe not. I tend to have my families just start with baby foods. The other thing to know is Gerber does a really nice job of making us parents feel like we have to feed our babies every stage of food that they have created. 19 years ago, when my first baby was born, there was only 1 jar of baby food. Gerber ones. It wasn't even once, it was just Gerber baby food. So they do a really nice job of making us feel like if we want our babies to be successful in life, we will buy them every stage that they have. The fact of the matter is, whatever you guys are eating, if you can squish it up or mush it up or puree it, and your baby can manage the texture and the flavor, you don't even need to buy baby food. You can, it's convenient and it's handy, but it's not necessary. Sorry, you get some of my editorials too. I mean my experience. So the foods to avoid, regardless of how you're feeding your baby: egg whites, peanuts, tree nuts, fish, shellfish. Now, wheat and cow's milk are difficult to avoid. And cow's milk and soy, you may even notice prior to introduction of food if your baby's having problems. You certainly will with cow's milk. And if your baby goes over to soy and you see problems there, you'll notice there as well. Citrus fruit and berries. So essentially, if your baby's not having any problems with wheat, cow's milk, soy, the ones that you want to avoid are the other ones. The other food to avoid is honey, but not because of the potential for allergy, because there is still a concern that there can be some botulism in honey. So you can get the toxin in honey, technically, and it can be a dose that could be detrimental to an infant. Okay, got all those. They need some kind of formula or breast milk until they are a year, mostly because cow's milk does not have iron in it. That's the biggest reason, to be truthful. And it is a little bit harder on their tummies, but you can transition them pretty easily. By the time they're a year, they'll just typically take it however they were taking their milk previous. If they don't like cold milk, don't think you're going to give them a cold glass of whole milk and they're going to enjoy it. You may need to transition them a little bit by making it room temperature or making it warm. And once they transition, 16 ounces a day is probably enough, 2 cups. Now when they're 15, I'm going to tell you what, they drink a lot more than that. And again, try and get them off that bottle by the time they're 1. It's better for their teeth, and it's going to be a lot better for your guys' frayed nerves. Toddlers. Oh, toddlers, they're fun. So ultimately, our goal when we are feeding our children and working through this whole process of feeding is to get them to what we think is the social norm of 3 meals and 2 snacks a day. Or in my house, 3 meals and 13 snacks a day. I have teenage boys. The trick is to offer them the healthy foods. Toddlers would probably take a chip or a French fry over an apple. But if they don't have the chip or the French fry, if they have the apple, they're going to take the apple. So they're going to start calling the shots a little bit, but you're still the parent. Have the healthy snacks out and do a variety. Toddlers go through periods of time where they love a food and they hate a food. Doesn't mean they're going to love it forever and hate it forever, so you have to keep reintroducing it. They may like it, they may not. And if you have a spouse or if you yourself are not a veggie lover or a fruit lover, still offer it to your children. They should at least have the advantage of deciding for themselves. As far as what they should drink, up to 16 ounces of milk a day. Up until they're 2, we recommend whole milk, but that could change based on how your child is growing. If we have a child that's sitting at the 95th percentile, and they're 15 months, 18 months, I'll let the parents go to buy the child whatever milk they're drinking so that we're not drinking all kinds of different milk. You don't need a kid that's sitting at 100th percentile and drinking whole milk. Our kids get plenty of fat in their diet. Limit juice. I'm not a big juice fan for reasons of dental health and oral health. By limiting juice, I mean there is a rule for juice. Juice works really nicely if you have a child that is getting constipated because of their diet. Apple juice, grape juice, prune juice really does help. And I think that's where maybe the rule is. And water. Actually, I would rather they have water than juice. And probably they don't get enough water. Now, you don't want an infant to have water because their kidneys are immature. But by the time you're dealing with a toddler, they can drink water. They can drink, it's actually good for them. They can drink whatever water they want. So speaking of teeth. So first teeth are typically between 6 and 12 months. Some babies get teeth as early as 4 months. But typically they'll start teething at 6 months. Don't freak out if your baby doesn't have a tooth when they're a year. They're going to get their tooth. They're going to get their teeth. By age 3, usually they've got all their teeth, or at least all their primary teeth. That's pretty much it. As far as when to call the dentist, I think that's on this next one. Might be on the next one. Let's talk about teething some more. So symptoms of teething, obviously excessive drooling, but babies drool for a lot of reasons. So don't be surprised if your baby's drooling at 2 months of age and they don't have a tooth. Babies breathe through their nose. Babies get nasal congestion a lot, and if you've got a stuffy nose and you have to breathe through your mouth and your mouth is open, you're going to drool eventually. Putting things in their mouth, their hands, typically, is another sign. Swollen gums, and you can feel the swollen gums when you look in their mouth and one part of the gum looks puffy. They're probably teething. The other thing you'll see is a little slit sometimes before the tooth is erupted. Don't get discouraged if you see the little slit or you think you see a tooth and then there's nothing there. Teeth are just funny little tricky things. And then the things to do for them are Tylenol. Let them chew on things, cool washcloths, doggy bones. Just kidding, not really. And teething gels, again, the people that make these like to let us as parents know that we're doing the best thing we can for our child by relieving their discomfort. Problem with teething gels. Well, when baby teeth are getting teeth, they drool excessively. If you put teething gel on a baby's gum as they're drooling excessively, that gel's not going to stay on their gum. That gel's going to go down their chin, along with your $5 that you just spent on it. It might go on their tongue and feel kind of weird. It just doesn't stay where you intend it to be. So it's not necessary and it's probably not going to help you. Your Tylenol is going to do better, as is letting them chew on something. High fevers and colds. High fevers and runny noses. Not associated with teething. You can see high fevers and colds in babies. You will see high fevers and colds in babies because they're exposed to all kinds of germs that they've never been exposed to before. But it doesn't have anything to do with teething. You may see stool changes with teething, but that's typically because maybe their appetite's changing. Not necessarily a reflection of them getting teeth. So how to take care of their little teeth? A wet cloth. Probably the easiest thing to do. Wipe their teeth off a couple of times a day. Once you see that little shiny white thing in there, start wiping it. When you give them a bath, wipe their tooth as well. You can buy a soft brush if you want, and you can brush the tooth. You do not have to use the fancy baby toothpaste. Save your money. Starbucks is down the street. Better way to spend it. You don't need to use that. Just need to use water. Brush their teeth before you or after you give them their last bottle or they nurse the last time for the evening. You don't want to have any milk sitting on those teeth as they sleep at night. That's how they get decay, particularly in between their teeth. Fluoride toothpaste, once your child can spit, like really spit, not just, and that's usually around 3 or 4. And you can sure floss those teeth when they are touching. Have fun with that one. I'll leave that at that. Okay. So here's concerns. Children with not even just juice, but milk in a sippy cup or a bottle just walking around all day long drinking it. We have saliva in our mouth for a reason, and one of the reasons we have it is to kind of keep our teeth healthy. When they are constantly drinking something that has sugar in it, and the milk and the breast milk even has sugar in it, the carbohydrates, that sits on their teeth and can cause a problem as well. So water's fine. If you've got a kid that likes to drink, that's when you put the sippy cup in the water and you let the child drink that. Bottle propping. That's when you put your baby in bed and you prop their bottle up on anything, something. An encyclopedia if you still have those in your home. Just say encyclopedia to your older children and see if they actually know they were books. It's kind of fun. They don't. So don't prop that bottle in there. And ultimately, the reason you don't want to do that is twofold. Your baby's sitting at the wrong angle to feed, and you're going to have an increased risk of ear infections. And secondly, that milk's just sitting on those teeth because, as you guys know who have fed babies before, babies don't, when you just hold a bottle in their mouth, they don't just always suck the whole time. Sometimes they stop, and then we take the bottle out or the bottle falls out. If that bottle's sitting in their mouth the whole time and they're not sucking, milk, juice, whatever's in that bottle is sitting on their teeth. And use water with fluoride in it. Either to mix their formula if you're using formula, or when they're just drinking water. Make sure that your water has fluoride in it. Now in Omaha, our water is fluoridated, so we're fine. My community in Plattsmouth, I have pockets that they do not put fluoride in the water. So those kids then, between me and their dentist, one of us usually prescribes some fluoride drops for those kids. You want to visit your dentist at 1 year or within 6 months after the first tooth erupts. Now this, in theory, is fantastic, guys. But I'm going to tell you, you will find dentists that are not prepared to see children until they are 3 years old and can sit in that chair. My advice to you is if you have access to a pediatric dentist, call the pediatric dentist because they will see children as young as 1. If you don't have access to a pediatric dentist, talk to your pediatrician. In my clinic, we put fluoride on children's teeth at ages 2 and ages 3, not to replace what a dentist does, but to augment what the dentist does, and knowing full well that a lot of our dentists in our community won't see a child until they're 3. And those teeth have been sitting in that mouth with stuff on them for 2 years. So, and that fluoride varnish is an easy, painless thing to do. Sleep-wise, well, newborns sleep 14 to 18 hours a day, but not all at the same time. They sleep a lot, but they sleep, they eat, they sleep, they eat, they sleep, they eat, they pee, they poop. That's what babies do. That's what newborn babies do. By the time they're 2 to 4 months, they're sleeping a little bit less. They're having a little bit more quiet awake time. Taking notes over there? Make sure you get all this, little fella. Okay. So they are a little bit more predictable at 2 to 4 months, but not really. 4 to 6 months, it gets a little bit better. By 4 to 6 months, they're usually sleeping through the night, 6 hours. I like to caution parents, the average age a baby sleeps through the night is 6 months. That's an average. That means there are some, and you guys have these friends, their kids slept through the night when they were a month old. Oh, they didn't. They're just telling you that. They were also back up to birth weight at 3 days. No, they probably run faster than your kid does too. 6 months is an average age. Some babies aren't going to sleep through the night. And through the night again is 6 hours, not 10. So we have to, let's not be too punitive on the little fellas. By the time they hit 6 to 12 months, they are sleeping 11 to 14 hours a day, and they probably are sleeping longer at night. And 1 to 2, they're sleeping 10 to 12 hours at night as well. Now, what if your baby only sleeps 8 hours a night ever? Is that baby defective? Do you send it back? No. No. Some children don't need 10 to 12 hours. Again, these are averages. These are numbers that we tell people because that's what most babies do, but not all babies. Some babies do just fine on 8 hours of sleep a night and 1 nap, one 1-hour nap, and they're great. They're happy and they're content and they're growing and they're developing. Back to sleep. I think all new parents get this kind of drilled into them now. So I don't have to say much on that other than once your baby is rolling, do not set your alarm to go check on your baby. If they are strong enough to roll over, they will get themselves out of a situation. So you don't need to go check on them and turn them back on their back. That is one of the reasons, though, we tell you not to put a lot of stuff in the bed with the baby. They don't need anything in there but themselves because they are going to roll over. So avoid all that stuff. And I don't even know if it's like in vogue anymore or not to have like baby bumper things. Don't put those in the crib. Again, save your money. Better way to spend your money. Some babies like white noise, just like some adults like white noise. There's nothing wrong with it. They don't have to have it. But if you find that that is comforting to your baby, use it. Again, there are a lot of toys and stuffed things out there that make noise for your baby. I don't know if it's the right thing or not. I tried it. Didn't work. So by the time they hit 2 to 4 months, you should be developing some sort of a routine. Now, you want to put your baby, we kind of sort of have to teach babies to sleep. Some babies are great sleepers. They'll just lay down and go to sleep. But some babies, we have to teach them. And to teach a baby to sleep, you want to lay them down in their own sleep space when they're tired. Sleepy but not asleep. And you need to be consistent with all of your nighttime rituals and routines. If you're going to read to your baby and toddler every night, then read. Brush teeth, get PJs on, read, lay down sleepy but not asleep. And make sure they sleep in their own beds for naps and nighttime. Now, I'm going to put the world on its side here for 30 seconds. These are your babies, guys. When your 2-year-old paddles into your room and wants to lay in bed with you, do I think that's a crime? No. Those babies are going to grow up so fast. Every family has to do what's right for them. I have families in my practice where there's probably only one bed in the whole house. And so the older children, don't put a baby, an infant in bed with you, but a 2-year-old, if that baby crawls into bed with my families, I don't get too ruffled about it, as long as it's okay with the family. Or dad works nights and mom just likes to have the kids with them. Nothing wrong with that. Besides, when they're little, they smell good. Then they get stinky. Speaking of stinky, potty training. Let them call the shots on this. Quite frankly, there are only a few things that a toddler can control. What goes in and what comes out. That's their control in the world. That's why you get all the food issues and the peeing and the pooping issues, because there's only so many things that they have any say about. So when they start recognizing that they're uncomfortable in their diapers and their pull-ups, they are telling you they want to check out the potty, follow their lead. That's when they're ready for potty training. Again, you all have friends whose child was potty trained at 9 months. A little tricky when they can't walk and take their own pants down. Just ask those questions, see what happens. Again, I love that. Have a desire to be clean. Boys usually later than girls, like when they're 16. But that has had to do with the pooping. That's just showering, I think. And then they shower a lot. True. So when they're expressing the desire to get that off of them, I poop my pants, icky, then they're ready. Ultimately, I like to see parents introduce the potty around 18 months, just because I don't want a child to be afraid of it. And children get afraid of the toilet, and then we have problems. So open door policy, if you're not too modest for that, is perfect. Kids are curious. They want to see what you guys are doing. And they want to mimic you. They want to do what you're doing. So they'll kind of follow your lead. Most children are ready by the time they're 3. Most children are ready by the time they're 3. Some aren't. Some are ready by the time they're 2, some by 4. If you make it a battle, you will in some way, shape, or form lose that battle. Follow their lead. They'll kind of let you know. Avoid peer pressure. I go back to this. Avoid peer pressure. It'll happen when your child is ready, and your child and you will know when that is. I don't think there's anyone that advocates disciplining around toilet training. Positive praise is fine, but you will likely end up with a whole host of problems, including constipation, if you discipline around potty training. Again, there's only so many things they can control, and being a toddler is a lot about trying to control your environment and being independent. Lots of conversations about pottying, lots of cheering, training pants. Now, this is for daytime stuff. Don't get alarmed if your child is having nighttime wetting that is inconsistent with what's happening in the daytime. Nighttime wetting is a whole different beast than daytime. So you can have a child that's trained, that's using the potty by the time they're 2 or 3 during the day, and at nighttime might still be wetting at 4 or even 5. Whole different thing. So don't stress about that. And if your child is having nighttime wetting accidents, I encourage you to talk to your pediatrician about it, because again, whole different thing. Yeah, if they're having a lot of accidents and they're really, really fighting you, they just may not be ready. Okay, I'm like not talking very fast. Sicknesses. Children are supposed to get sick. They start life with a limited immune system. This is why we give them their immunizations. We're taking advantage of that. Under the age of 5, a child will get on average 8 viral illnesses a year. Most of those last 7 to 14 days, viral illnesses. They're usually contagious for the first 3 to 4 days. Viral season for us here in Nebraska usually starts around October and goes through March. That's when we see the majority of our viral illnesses. When you start doing the math and a kid is sick for 7 to 14 days with a viral illness, and we start in October and we go through March, and they get 8 on average a year, yes, kids have runny noses from October till March. They do, so don't be alarmed. Now, when do you get concerned? And I think that's on the next slide. We'll get there. Persistent fevers, things like that, but we'll get there. Usually the second child gets more infections than the first just because they're exposed to more. And we're not afraid to take them out anymore, so we take them out and travel. Fever is anything greater than 100.4. I say greater than or equal to, but greater than 100.4. Don't worry about adding or subtracting. Just take the temperature. If it's greater than 100.4 and your child is acting sick, call your pediatrician. If it's greater than 100.4, and this is for a child that's over 2 months, if the fever is greater than 100.4 and the child isn't really acting sick, watch them. Now, if the child is less than 2 months old, that's a different story because they are so immature in regards to fighting infection. We want to know about infants that are less than 2 months old with fevers of 100.4 or greater. How do you know if it's bacteria or virus? And this is where I was getting ahead of myself. A kid with a bacterial illness will look sick. I don't really like that line very much because a child with a viral illness can look really sick as well. But a kid with a bacterial illness will look sick. They will typically have fevers lasting more than 4 days, or the fever will be there for 2 days, go away, and then you get another fever again. That's an indication that you may have a bacterial illness that you have to deal with. Localized area of infection, a big red, puffy sore on the arm, or mommy, my ear hurts. If there's a localized area of infection, then you want to make sure it's not bacterial. Or abnormal lab work, which you guys can just, I don't know, draw that and look that up yourself, I guess. Green snot does not equal bacterial infection. Color of snot does not mean that it's bacterial viral. It just means that it's having some kind of a chemical reaction as it's coming out of the nose and meeting the air. So don't worry about green snot. Duration of snot might be interesting to a physician. So if you've got a kid that has had a consistent and persistent runny nose for 2 weeks, when the average cold lasts less than 2 weeks, that's something you want to bring to your doctor's attention. I'm going to make a statement for all pediatricians out there. If you have any concerns that your child is sick, get your child in to be seen. You don't have to make these assessments on your own. That's why we're here. That's why we have nurses and staffs. Safety, car seats. You can read all this stuff. Water. The one thing I will tell you that you can do in your own home, if you can adjust the water heater to 120 degrees highest, you could potentially prevent scalding injuries with that. So if you have any access to your water heater, lower your water heater temperature. Baby proofing, obvious things. Promoting child development. I like this one. Hold your child. Cuddle your child. Be with your child. The babies that we give birth to as humans are neurologically, and in every other way, immature. We don't give birth. They don't stand up and walk and find their own food. If they did, they wouldn't need us. They need us. We need to hold our babies. If anyone out there has a mother-in-law or a friend that tells you you're spoiling that baby because you're holding it too much, you cannot hold your baby too much. That's how they develop neurologically. It's how they develop. And you worked really hard at it. You might as well enjoy them. Sing to your baby. Exactly. See, I'm getting kudos over there. Tummy time. We talk to parents about tummy time from the time that baby's born. Because we do want babies to be able to get themselves out of situations if they roll over on their tummies. We want them to have neck and upper back muscles that are strong enough that they can pull their heads back. Tummy time also includes that chest-to-chest time that you have with your newborn, because newborns love to look at your face. So they will pull their head back and they will look at you. That's tummy time. Play with toys, mostly because they're interesting. And play games with your kids. Always play games. It's fun. Oh yeah, and enjoy every single stage because they grow up fast. They're stinky and stinkier. That fish isn't as big as it looks. His grandfather taught him that if you hold it closer to the camera, it actually looks bigger. Yeah, so that was nice. Thoughts, questions? I kind of went through those last few really fast.
At what age do you give them water?
At what age to give water? So when a baby is, probably a good number to kind of keep in your head is 6 months. But even at that age, you don't want to give them a lot of water. Now, your pediatrician may say differently if you have a baby that's constipated. Because if your baby's constipated, a lot of times it's easy to give them about a half an ounce of water on a day that they're constipated and see if we can get their stools softer. Other questions? Yes?
So you talked about the teething gels. What about the teething tablets?
Yeah, the teething tablets. They have really, really become popular. And I don't discourage my families from using them. I don't have any personal experience with them, and I have looked to see if there's anything out there that says if they're worth your guys' money or not. I haven't found anything fantastic out there that supports it one way or another. They're harmless. Yeah.
Any tips for weaning them off the bottle?
So I had one that just got done with it on his own, and I had one where I had to take it and hide it. If you have a kid that really, really loves their bottle, I will tell you, anytime you try and affect a little person's behavior, not a teenager's, a little person's, you can expect 3 days of transition time. So if you want to make the bottle go cold turkey, you're going to maybe be a little unhappy for 3 days, but then they'll get over it. They'll find something to replace it. If you want to just eliminate one bottle a day, again, they may have a little fit. That might happen for a couple of days, and then they're going to recover. They really, really do find stuff that takes the place of what they think they love so much, really nicely.
Well, it just sometimes he doesn't. I try to feed him 3 meals a day, and sometimes he just doesn't want to eat solid food, and so it's like, okay, well, what am I supposed to do? Not give him the bottle, but I try to avoid giving him the bottle so that he'll eat, but then he's just like, no.
And that's okay. Put the milk or the formula into a sippy cup. Because it's not what he's drinking that's a problem, it's the way he's drinking it. So he can have, and honestly, if your kid wants to take more than 16 ounces of milk after he's 1, that's fine, as long as he's eating other foods. There is an entity called milk and crackers anemia. That's kind of our little term we've coined for babies that don't do anything other than eat carbohydrates and drink milk because they get anemic. So we want to see babies have, and 1-year-olds have, a variety of foods in their diet. But if they've got a variety of foods in their diet and they want to have 20 ounces of milk a day, that's fine.
What about thoughts on vaccinations and not doing more than 2 at a time, or?
I think that's a conversation that you have, thoughts on vaccinations and how many to do at a time. I think, /no, that's a conversation you have with your physician. I have a lot of people in my practice who have very strong opinions on how vaccinations are given. And my personal belief is I will always counsel on what I think is the better way, or what I have learned is the better way, but we can come to a happy medium. Some people don't want to immunize or vaccinate more than 2 shots at a time because their hearts are so big and they don't want to see their child hurt. And that's okay. There's nothing wrong with that. If your pediatrician is the right pediatrician for you, you guys can work out a plan for that. There are very obvious vaccines that as pediatricians we want to get into babies as soon as possible because there are scary childhood illnesses that they will come into contact with. And there are others that maybe we can put off for a little while. And that's a conversation that you should have with your doc. Anything else? Well, if there's not any other questions, do you have another question?
Well, so they talk about weaning off the bottle, but what about off the breast? Like
I think you make your significant other take you to Las Vegas for 3 days and give your child to your parents. Actually, weaning from a child that loves to nurse is a hard thing to do. And sometimes it's one of the most horrible things a mother can do because you feel so guilty. You can do it the same way. You can eliminate 1 feeding a day, replace it with a sippy cup with breast milk in it. There's nothing saying your baby cannot have breast milk. Firstly, there's nothing saying you can't nurse as long as you want to nurse. Every mother and child have to figure it out for themselves. Every family has to figure it out for themselves. There are no rules. But if you're ready to transition at a year, what you do is you can take 1 feeding session out a day, or you can go cold turkey. Or you can say you're going to go cold turkey and decide the next day or not. It's okay. They'll all grow up fine. Anything else? Okay. Well, thanks, guys. Oh, thank you.